You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mother of four, and a teratogen information specialist. So what I do is I talk to people, so patients, their family members, healthcare providers, about exposures before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So a chemical that you work with, a medication, and in some cases, it could actually be a medical condition. So today, we are going to be talking about one specific medical condition called lupus. And to talk with us, we have a very special guest. Dr. John Esdaile was the founding scientific director of Arthritis Research Canada. He has been professor and head of the Division of Rheumatology at McGill University and the University of British Columbia. He has held many positions leading research teams nationally. He has authored more than 280 publications in journals, more than 24 books and book chapters. His major areas of research interest include lupus, rheumatoid arthritis, and osteoarthritis, with a focus on early diagnosis and intervention to reduce disability and to save lives. He has won multiple awards for his work over the years, and we are so lucky to have him with us today. Dr. Esdaile, welcome to the show.
Thank you very much, Chris. I'm very excited to be on the show.
So let's start with the basics. What is lupus?
This lupus is a rare condition. It is a disease that can affect many different organs, which has led to it being called a disease with 1,000 faces. It can be difficult to diagnose, and many patients who are diagnosed with lupus have to go through a period of time seeing different physicians trying to figure it out. However, common things are almost everyone is tired. Fever is not uncommon. Almost everyone has joint pain. They have pains in their joints. And many people have skin involvement. However, it is a multi-system disease, so there's really no organ in the body that can't be affected. Brain, heart, lung, kidney. It is that widespread involvement that's possible that can make it hard to diagnose. The mechanism of it is said to be autoimmune. Our immune system is really our body defense system. It's what keeps infections out of the body and controls things, perhaps like cancers, prevents them. But in lupus, the body's immune system is not functioning as normally as it should, and it can be making antibodies and altering immune cells in a manner that is causing all of these symptoms.
So tell us about your experience working with people with lupus.
The first patient I saw with lupus was in about 1970 as a student. And you believe it, what has happened has been a dramatic change over the last 50 years in how we think about lupus and how well people do and how we treat lupus. So it's been a very exciting area to be involved with, not only from a research perspective, but just helping people with lupus deal with the disease. It's a disease that affects young women in their childbearing years. So most commonly, it's between, say, age 18 and 35, although it can occur in people who are older and people who are younger.
Mm-hmm.
But nonetheless, it's a time of life where a lot is often happening, and the last thing you want is a disease that's affecting all of these different aspects.
Mm-hmm.
And the great thing over the past, and particularly the more recent past, say the last 20 years, has been a much better understanding of the mechanisms of lupus and how to interfere with those mechanisms to return a person to being more normal and being able to have a normal life. As you've gathered, lupus affecting many different organs, or possibly affecting many different organs, it's referred to as disease activity. That is the disease active? We've realized that the active disease, the process, can lead to damage, and that the way to prevent damage is to interfere with that disease activity, mainly through drugs.
So you said certainly, can happen at any time, more commonly in people who are between ages 18 to 35. And so for a lot of women, that's the time that they think about getting pregnant, starting a family and things like that. So how can lupus affect a person who is pregnant or breastfeeding?
Okay, let's start with pregnancy, and there's no doubt that lupus, the disease, can affect pregnancy. It can make the pregnancy more difficult. The key thing for me as a physician, being the rheumatology side of the team, is to tell patients early on that if they're thinking of becoming pregnant, we're going to have a big chat and we're going to assemble a pregnancy team. That this is a disease where bringing in an obstetrician who is very knowledgeable about lupus, the rheumatologist, and perhaps other subspecialists that are relevant to that individual patient, perhaps a kidney doctor, perhaps a brain doctor, perhaps a lung doctor, whatever is needed, to have a team ready so that we are going to have the pregnancy unfold the way they want it and we want it. I've just had my third grandchild, and there was some obstetrical excitement, so that even if you don't have lupus, pregnancy can be problematic for some, and lupus just adds to it. So having a really good team and being well informed in advance about the pregnancy makes a huge difference to outcome. Now, what are the problems? I think that's what you were getting at. Well, you can deliver babies early. The babies can be smaller than the average baby. There are some problems with blood pressure, all of these things can occur during a normal pregnancy, but are a little more common in a lupus pregnancy. So that's the reason we want to have a lot of discussion before the pregnancy actually occurs. In preparing for the pregnancy, there are certain drugs that we don't use in pregnancy in lupus. So that conceivably someone may be taking a medication or drug that we're going to stop and change. And then there are other things that we start specifically during a lupus pregnancy where maybe we wouldn't be doing that in a non-lupus pregnancy. And there are favorite drugs we have for lupus pregnancy because they seem to put no additional risk to the baby or the mother, but make the actual outcomes, the result of the pregnancy better.
And the other thing is, you're right, certainly for something like lupus, but really for any condition, having that medical team talking about it when someone is considering pregnancy. Now we know, not every pregnancy is planned, but if that comes up, if that's something you're thinking about, talking with your providers, having a plan for any treatment, as you said, there's pain, tiredness, of course, other effects, plans to monitor the pregnancy. It's such a good point that talking about it, especially as soon as you know that you're pregnant or think that you want to start a family, is such a good idea. So do you get questions? My guess is, of course you do. What are some of the common questions you get about lupus during pregnancy?
I think the first question that people often ask is, am I going to have trouble getting pregnant? Mm-hmm. And the answer to that is basically no. The secret to a successful lupus pregnancy is now well known, and that you want the lupus to be really well controlled when the person becomes pregnant. So we tell people, look, if you have very active kidney disease right now, we're going to get that kidney disease all controlled, and then we're going to have the pregnancy check. But the actual ability to become pregnant is normal. The role of the inflammation due to the lupus is probably the key, and we've learned over and over that having it controlled at the time the individual becomes pregnant is the most important thing we can do to have a successful pregnancy, an uncomplicated pregnancy, something that's very close to normal. The people with lupus are often on medications, and one of the reasons we like planned pregnancies is that there are some medications we really don't want them to be on if they're trying to become pregnant. And so planning allows us to make alterations in the treatment, make sure that everything is still well controlled, and then say, go for it. Let's do it. Let's have a baby. And that really makes, I think, a huge difference. The pregnancy still, can result in babies being born a little early or being perhaps a little small, but the reality is the frequency is going to be very close to normal, and that's what we want.
And I appreciate that the messaging is, not don't get pregnant. It's, we want to talk about it. We want to plan it with you. We want to make sure that your disease activity is well controlled. We want to make sure that you're doing well. We want to make sure your pregnancy is doing well. It's a very supportive message. And again, not just lupus. There are other conditions too where sometimes people think, can I, should I? I'm taking a medication. Of course, they contact us at MotherToBaby about, are there risks or, what's going on with this medication in pregnancy? And as a healthcare provider, I really appreciate you saying, let's get you where you want to be. And as you said, let's get busy. Let's have a baby.
It makes all the difference. It's really key to happy endings for everybody. And, it used to be that a long time ago, even before I started, that women with lupus were advised not to become pregnant. Mm-hmm. Now, today, there are, lupus clinics where they perhaps see a lot of lupus patients, and the wall is covered with baby pictures. So it's been a huge shift, and a wonderful shift, for sure.
That's the best wallpaper in the world. Covered with absolutely happy baby pictures. So, Dr. Esdaile, thank you for being with us today. But before we go, what final thoughts would you like to leave our audience with?
I want to just mention that another question that's common is, can I breastfeed my baby? Mm-hmm. And the answer is yes. There are some, again, medications that we don't like the mother to be taking. if they're breastfeeding, but most mothers with lupus who have a baby are able to breastfeed if that's what they want to do. So that's another good thing. I think the overall message is that we are learning more about lupus. We're getting, for the first time, new medications that are probably going to turn out to be even more helpful than what was present a few years ago. And there's a lot of activity in research on new ways of controlling lupus disease activity, which is going to, I'm sure, make pregnancy easier and the outcomes even better.
Excellent. And just as a reminder to our audience, MotherToBaby is conducting a study looking at lupus during pregnancy. So, Dr. Esdaile, we are just trying to continue the amazing work that you and your colleagues have done over the years for folks with lupus, but especially in pregnancy. And thank you for everything that you've done, not just for patients, but for the field in general.
Thank you, Chris. It's a pleasure, and I think it's great. The more information you can get out for people with lupus, the better they're going to do.
I agree. Thank you. And to learn more about all of our pregnancy studies, including the MotherToBaby study on lupus, be sure to visit our website at MotherToBaby.org. And thank you for listening to another episode of the MotherToBaby podcast. Please make sure that you tune in for future episodes, and you can also go back and listen to previous episodes as well. You can find us on iTunes, Spotify, or however you listen to podcasts. And don't forget to subscribe so you never miss a new episode. And remember, MotherToBaby is here to help you with your questions about anything during pregnancy or breastfeeding, while you're planning a pregnancy, or if you're thinking about adopting. You can reach us by phone at 866-626-6847. You can reach us by text at 855-999-3525. You can visit us on our website at MotherToBaby.org, where you can find information about our studies, information about conditions, all of our fact sheets about exposures, and you can also chat with us there as well. And if you have an idea for the podcast, or if you want to be on the podcast, we want to hear from you. So please email us at contactus@MotherToBaby.org. Goodbye until next time, and remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit MotherToBaby.org.